Now, China's National Health Commission is briefing on the coronavirus outbreak. Let's cut across live and listen in to the latest updates.
Standing difficulties in production and transportation, as well as the supply of such materials. I want to make a special emphasis that this mechanism is a temporary and emergency response mechanism. Once the epidemic situation eases, we will withdraw such a mechanism. We will have last two questions. The journalist in blue. Thank you. From China Health Magazine. Just now, medical teams, has been mentioned that medical teams are sent to the epicenter. Then how about their local needs? Also, in some localities, hospitals have suspended the outpatient departments. So how are those local medical needs satisfied? It's a very good question. On the one hand, we need to ensure the epidemic prevention and control. But on the other hand, we should continue the daily operation of the healthcare facilities. So for areas with a very challenging epidemic situation, the priority is to treat the patients of NCP or the epidemic, and in particular the key populations like the elderly, the pregnant, and the young. Also, for patients like the cancer patients, their medical needs should also be satisfied. For areas where the epidemic situation is not so serious, it is required to ensure the smooth operation of the medical facilities. The aim is to ensure that the healthcare system is functioning adequately, and also at the same time, we will not we will continue to ensure the daily operation of the medical facilities. It is fair to say that the online consulting services can play a very important role. It can guide the patients to seek medical advices and reduce the nosocomial infection. Many localities have accumulated success stories like Zhejiang, Shanghai, and Beijing. They have offered online medical consulting services and accumulated experience, best practices in this regard. So while saving the NCP patients, we should also treat the patients as in normal times. The last question. Thank you. From China Family newspaper. For the medical protective supplies, has the shortage affect the work of the medical professionals? Madam Guo, for medical protective supplies or materials, they are really important, as you know, in the daily work of the medical professionals. When our doctors and the nurses are receiving and taking care of the patients, the risk to be exposed to the infections is quite high. So the medical supplies are extremely important.